All right, guys, thank you for waiting and thank you for coming. So I'm Chrissy. I work with Granite Peaks just across the street, or parking lot. There's no street even. So I'm here to talk to you guys today about hemorrhoids, everybody's favorite topic, whether it be at Christmas at the dinner table or, like with friends and family in the newsletter. But just before we start, a little bit about me. I'm Chrissy. I'm obviously very bad with technology. But I'm working on getting better. I'm from Chicago. I've got a whole bunch of degrees, but this is the only one you need to worry about. I got my degree in physician assistant studies from Pacific University in Oregon a couple years ago. I'm kind of new, but that's okay because I have really cute animals to make up for it. That's my dog Tommy, and that's my cat Abraham Lincoln. So there we go. Back to the real reason we came here. So what's a hemorrhoid? I don't know what your guys' understanding of hemorrhoids is or personal experience. We won't ask about that. But hemorrhoids essentially are normal parts of human anatomy. So whether or not you knew it, everybody has hemorrhoids. They're just veins found inside of the rectum. So they can be either here internally or externally. So typically hemorrhoids just serve to drain blood from the pelvic floor back to the heart, just like any vein would. But what happens as we age or as other things occur, they can become dysfunctional. And so when you really notice hemorrhoids is when they become dysfunctional. And so what happens is a vein that's normally tucked up really nice here can kind of sag out of position, both internally and externally. And when they sag, that creates a whole host of symptoms, and that's normally when people come knocking on my door. Okay? So internal hemorrhoids occur here above an anatomical point called the dentate line, which is something you'll want to write down because it's going to be relevant to you later. I'm just kidding. Don't worry about that. That's my job. But internal hemorrhoids are here above that anatomical line. What that means is you could have hemorrhoids and not even realize it. Okay? So internal hemorrhoids manifest in one way, and external hemorrhoids, which occur externally here, kind of manifest in another way. So internal hemorrhoids, can be graded from 1 to 4, depending on how severe they've gotten. They tend to progress if they're not treated. But grade 1, they kind of tend to stay up here inside of the rectum. Grade 2, they kind of bulge out but go right back in. And grade 3, they're going to bulge out and really cause you a bunch of problems. And we call that symptom prolapse, which we'll talk about more in a second. But then external hemorrhoids, sorry about the visuals here. That's a little bit of my bread and butter, but it can be a little shocking. So external hemorrhoids tend to be more of a veiny bulge outside of the rectum. And so those are pretty obvious if you have those. You either do or you don't. You're going to know all about it because it's not going to feel good and it's going to be visibly present, or you may feel something like that. Fun fact for you, they can be the size of a pencil head, and they can also be the size of a small orange or a clementine, and so that's when my job gets really fun. Well, fun to me, maybe not to more normal folk in the crowd. But who gets hemorrhoids, like we talked about? Since everybody has normal anatomy, everybody technically has hemorrhoids. It's just a question whether or not they're bothering you. So actually, hemorrhoids become symptomatic in about 10 million Americans, making it the third most common gastroenterology issue that we see. So about 5% of Americans will suffer from hemorrhoids at some point. So if you feel like you got hemorrhoid symptoms and you feel isolated, do not. You are in good company, and you can always come see us and get appropriate care, because unfortunately what happens is people live with hemorrhoids, and they don't come in, and they suffer for a lot longer than I have to. So this number is actually probably underestimated because we're not treating as many as we should be. So risk factors for development of hemorrhoids. Unfortunately, being greater than 45 here sets you at an increased risk. Just as you age, the tissues become kind of less strong and integral and a little bit more elastic, and that can allow hemorrhoids to develop. Obesity puts a little bit more pressure on the pelvic floor. Pregnancy, chronic diarrhea or constipation, low fiber diets, and straining with bowel movements. And everything that you can prevent is highlighted in red. And so I have a picture of my favorite product. I promise you I'm not sponsored. This is Metamucil fiber supplement, is my favorite fiber supplement, and it's something to consider for all Americans. We do recommend you get about 30 grams of fiber in your diet, but most people are falling around 15 to 18 with a normal diet. So it's actually really hard to do, and I'd encourage you to go home and track your fiber and see if you're making the cut, because most people are not. So how do you know if you have hemorrhoids? Symptoms of internal hemorrhoids tend to be painless bleeding. So if you have pain, that can be indicative of another problem. Hemorrhoids normally don't hurt, at least internal ones. External is a different story. They're typically bright red in color when you notice bleeding. It's on the toilet paper. It may drip into the toilet. It may be on top of the stool. Those kind of features are a little bit reassuring, but if you see different colors of blood, that can be a little more indicative of something else going on. And anytime you see rectal bleeding, you want to talk to your doctor about it. So come on in and talk to one of us, and we can kind of direct you through what needs to happen. We'll talk more about that in a second. Hemorrhoids can also cause itching and irritation, soilage and leakage of stool, difficulty with hygiene, and then also a sensation of prolapse. And that's when those internal hemorrhoids kind of come out, and that's more often what happens when you have a bowel movement. Okay, and so a quick note about bleeding. If you do notice bleeding, the most common cause of painless rectal bleeding is hemorrhoids, but that's really for us to decide what's going on. I wouldn't leave it to any old Joe, because you can miss things that are more dangerous, and those things tend to be inflammatory bowel disease, colorectal cancer, a disease called diverticulosis, and sometimes cuts down there called anal fissures. So these are less common, but they do occur. So typically you start screening colonoscopies at the age of 50, which you do at certain intervals until the age of 80, and then you stop. But that doesn't mean that 80 is the last stop along the line for colonoscopies. If you develop symptoms such as bleeding or pain, then that may indicate that it's time to come in. So anytime you have a symptom that's concerning, just make sure you talk to your doctor about it. So how can you prevent hemorrhoids? Essentially by reducing the risk factors that we talked a couple slides back about. And so it all kind of, in my mind, goes back to our friend fiber, or Metamucil. It's because fiber can do lots of things for you. One, it can prevent that constant diarrhea or constipation symptom. It can help you lose weight. It can kind of give you a form or bulk stool, all which helps prevent hemorrhoids. But it also has a lot of other advantages, such as controlling your cholesterol, blood sugar, and it tastes great. Not according to most of my patients. But high fiber foods include good fruits, good veggies, your nuts and seeds, and also grains, okay? So you can have a really varied diet that's high in fiber. So back in the day, treatment for hemorrhoids was a little more grim than it is these days. So, back in the 70s, the treatments were laser therapy, topical ointments. You've heard of Preparation H, I'm sure. I'm not sure if I'm allowed to say brand names. So over-the-counter hemorrhoid creams. Also surgical intervention, okay? So that's what is the typical standard back in the day. But most people just turn up the volume on the TV and watch their favorite show on Netflix and ignore it. And that was unfortunate because there's a lot to do about hemorrhoids. So that brings us to modern day treatment in the now. So we have a hemorrhoid banding ligator, which is a fancy term for a plunger, more or less. So the advantages of this hemorrhoid band ligation procedure is that it's quick, it's easy, it's in office, there's relatively no pain, some discomfort on occasions, but most of the time people don't even realize it happened, okay? And there's really no recovery time. Again, a little bit of discomfort sometimes on occasion, but that almost resolves entirely. So that's the disclaimer there, but it's really, really effective. And so almost all our patients are just ecstatic that they've done it and are a little bit bummed that they hadn't done it yet. That's probably the only complaint I get, or the most frequent complaint. It does require a series of 3 treatments, but it's easy. You come into the office for about 5 minutes each time. You get to hang out with me, and that's great. Maybe. And then you feel a whole lot better. And if we have time at the end, I can show you a video about the procedure, and I'll give you a little bit of more details if there's a lot of interest from the crowd, as there tends to be from all 3 of you. All right. So if you feel like you or a loved one suffer from hemorrhoids, what can you do? You can give us a phone call at Granite Peaks. There's our phone number there. And you can see me, or if I've sufficiently put you off, you can see one of our 8 other well-trained and compassionate providers. And we are just, in fact, if you open the window and look through the tulips, right over there. So that's my talk, and I appreciate you guys waiting the extra time to see me. Yeah. All right. Does anybody want to see more images? I'm just kidding. Yeah. Q&A time? Donut time?
YouTube video. Does it work?
Let's see. That's why I didn't click on it. 1 second.
I'm like, it probably. Oh,
I just wasn't sure if they'll allow it. Here we go. 1 second. So while we're waiting for what surely could win an Oscar cinematically, it is a pretty simple procedure, so if you want to know more about it, really what you do is you come in, you get a rectal exam, which is, you know, a relatively mild experience, I guess, and then we can determine how to best treat your hemorrhoids. And if we determine you need a banding, then it happens in office that day. Essentially, we insert the rubber band ligator where you can imagine it goes, a little bit of tissue is pulled up into the ligator, and then we push a little rubber band around the base of it. And so you've just got a little choked off bit of tissue there, and over the course of a few days, the tissue dies, kind of sloughs off, for lack of better terms, and then you're left with a small ulcer. As the ulcer heals, the tissue surrounding it heals, and then that sagging becomes a nice kind of tight formation. So if you talk to Kyle Barnett, who's from Texas, he'll say it's like castrate in a bowl. But I don't say that because I didn't grow up on a farm. So I don't think it'll work, but giving you a nice verbal tutorial. Yeah, I don't know. Yeah, you actually probably could just go on YouTube. Sure.
We actually do have it on our YouTube page, the video, as well as on our website.
Great. Well, while we're wrestling technology, does anybody else have any? So you can, like kind of, we could go back to that slide here.
We can send that out to everybody too. Yeah. And if you have your email over there when you log in, we can actually send you that link.
So external hemorrhoids can start externally.
You can watch it.
I love watching
Yeah.
hemorrhoids.
You can't band external hemorrhoids, unfortunately, but this is a little bit more complex hemorrhoid science. But the two plexuses of veins are connected kind of indirectly. So we have found that once the initial external hemorrhoid heals on its own, which it essentially always does, we can treat by putting a band in line and above that external tissue. And what that does is it reduces blood flow externally, but it also pulls up some of that. What can happen is redundant or excessive tissue from a healed external hemorrhoid and indirectly treats it. So though the banding's not indicated for that, it's frequently used and frequently used very successfully. I mean, there's other things to do about external hemorrhoids as well. Sometimes we cut and drain them. Other times we just manage them symptomatically, pain management. It just depends, and so that's why it's best if you do have symptoms like that to come in and see me, because I've seen enough of them now to know what to do. Like if you just get one and you leave it alone, it can be a few days, it can be up to a few weeks, depending on the size and depending on what you're doing to either help it along or perpetuate it. So, I mean, prolonged sitting, straining, lifting heavy stuff. I get a lot of really fit and active guys who get hemorrhoids. That takes longer, but if you baby it, you know, you stay off your bottom, you can sit in a warm bath, you keep your bowel movements normal, they normally tend to go away in a week or two. So essentially it's just a pressure game. So imagine if you applied pressure on veins from above, it causes them to sag out, and that's when you get kind of symptoms. So pressure from any number of things, but pregnancy here in Utah tends to be one of those biggest things. So a lot of people I see are young women, and they didn't think there was anything to be done about it, and there actually is. So yeah. Well, so you actually don't have nerve endings that understand pain above the dentate line. So as long as we put the band above the dentate line, you shouldn't feel pain. What you will feel is pressure, because you do have pressure receptors. So I guess we're having a hemorrhoid talk, so I'll just say it out loud. What you feel like is you feel like you have to have a bowel movement because of the pressure perceived in there. But that's probably the biggest complaint we have. And if people take Tylenol, ibuprofen, that tends to take the edge off of that, and you do just fine. So. It depends on your insurance, so we normally don't give quotes. We do have self-pay prices that Laura can refer you to if you want to know, but insurance tends to pay pretty well. Depends on the deductible. Yep. Questions? Anybody? Okay. Well, I guess that wraps it up. Laura, did you have something?
No, I was going to say, if you did, make sure to put your email down on the list, and that way we can email you out a link to that video that Chrissy was trying to show you today. So.
Otherwise, it's low fiber donut time.
Yeah,
Great. Awesome.
Thank you, Chrissy.
Yeah, you're welcome. Thanks for coming, guys. I appreciate you waiting. That's really great.